Welcome to the Let's Go Recovery podcast, where we investigate sobriety and beyond that, explore solutions to help us heal at the core, where the root of our problems like addiction or alcoholism begin. We hope you hear something in today's podcast that ignites a change in your life.
I'm here today with Kathryn McCormack, the Social Service Liaison for a vital organization here in Mesa, Arizona, a nonprofit serving the community in a way that is maybe a little different from other guests I've had on my show. So I'm going to let her jump in and tell me a little bit about Jacob's Hope. First of all, thanks for being here, Kathryn. It's a pleasure to have you on the show. But more importantly, I want to know about Jacob's Hope and the work that you guys are doing in the recovery community and the vital work that I'm talking about you doing here in Mesa.
Wonderful. Well, thank you so much for having me. It's great to be here and share our mission with your audience. So Jacob's Hope is a nonprofit, 501c3, and we support substance-exposed infants and pregnant women with substance use disorder. So what that means is these women who struggle with addiction and find themselves pregnant or choose to be pregnant, then they face a lot of bias and stigma and judgment in the community from healthcare providers, pretty much anyone, their own families. So they hide and they don't seek out healthcare. So what we do is we really provide a safe place for these women and families to come, connect, have someone walk beside them, advocate for them. And then once baby is born, mom, baby, and caregiver, dad, whoever, they can come to Jacob's Hope and they room in together in our suites. And our highly trained staff, medical staff, will be able to support them through those withdrawal processes. Now this, coming to Jacob's Hope and similar nurseries, it avoids the infant having to go into a NICU after birth, because that is the traditional treatment for an infant that is born substance exposed, is they would go into the NICU, be put on a high dose of morphine, titrate down over an extended period of time. So for our infants, it's not an appropriate location because our infants they're not medically fragile, which is what a NICU is designed for. They're in withdrawal. So the bright lights, the temperature, the sounds, being alone for, a long period of time, because it's just not set up for these infants. So coming to Jacob's Hope, where we use mom as medicine, we utilize eat, sleep, and console. So the infants can be held when they need to be held. And we found that the average stay for infants when they come to Jacob's Hope is 5 to 7 days with little to no medication.
Wow.
So there are only 9 of these types of nurseries in the entire country. So Jacob's Hope was the 4th in the nation and the 1st in Arizona to be able to provide this type of support and utilize Eat, Sleep, and Console as a much better treatment for withdrawals for infants.
So you're saying that basically medically, this isn't a medical problem. I mean, it's certainly at some level, I'm sure there is, but at the core of these children, they just need to be held. They just need to be loved on in that process is more important than pumping them full of medicine.
And as far as NICUs, they serve a very vital purpose, right? So the medical issue for children with breathing problems, for internal organ issues, for any of these other types of medical conditions. So that would be where it would be appropriate. Our infants, they don't benefit from that. That's not what they need. We are a fully licensed medical facility, so we are able to provide NG feeding tubes. We do have medication if they need it. We are not going to have an infant suffer, but we also have other ways that we can console that infant throughout that before we use medication as our first line of defense.
Got it. I saw something on the news that you guys, quite frankly, have been struggling a little bit. And this seems to me to be absolutely imperative to the community. I'm blown away when you tell me there's only 9 in the country. That's shocking to me. So you're talking about any child exposed to opioids, narcotics, just major drugs are exposed to that. There's got to be an absolute overwhelming number of kids that this fall into this category. How is it possible that you guys, I'm going to say, are struggling, because that's what I saw in the news, and that's why you're here today, is like, I consider this group, the people that are surrounding you, absolutely imperative to helping this fragile part of our community.
Yeah.
Why? I mean, let's just get into that. Why
I mean,
is this? How is, this, how is it possible?
We as, an organization ask ourselves that daily. And I think that it's multi-pronged, and there's no one reason. But as far as there being so few of these nurseries in the country, it's changing a culture for medical care and for healthcare. And whenever there is anything new, there's always going to be pushback, right? So within a hospital system, having a NICU there to support medically fragile infants is also generating a lot of income for that hospital, right? Absolutely necessary. They do incredible work and are highly needed. But for this population of infants, this is not the best course of treatment. And to try to shift mindsets and change sort of views on this, right? Because when people think about a woman who's using drugs and is pregnant, there is so much in their minds. How could you do that to your baby, right? Well, there's also the education piece, because then you have to educate the healthcare providers that addiction is not a choice. No one would choose to harm the person they're growing inside of them, right? I mean, it seems very basic to me, and logical. But that is not the culture that we live in. And so to be able to change and shift mindsets and to say, hey, there's a better way to support these women, these infants, these families, and we can do that. Getting licensed is a huge issue, because whenever you go to the state and there's nothing like it that exists, so now we have another barrier.
Right.
The cost is astronomical. So you've got multi-levels of issues and barriers that come up. With Jacob's Hope in particular, we've had, I think it was just sort of a perfect storm with multiple factors with payers not paying on bills for infants that have come through our nursery, not being able to access opioid settlement money through the city and the state. So multiple things happening all at once has caused us to, really be in a position where we might have had to close our doors. Luckily, community stepped up. They funded us from the kindness of their hearts, because our community understands the importance of the work that we do.
Well, I'm glad to hear that, certainly. Yeah. I mean, that's a huge part of why why we do our show, but also why we do what we do, is the community is imperative to people. You hit on something that's, I think, babies and mothers aside, is a problem, a stigma around addiction, and that's that shame and guilt that she's carrying around, right? Like, enough people are going to tell me what a horrible human being I am, right? They're going to say it to me, like, I can't believe you did that, rather than showing up to your daughter's basketball game, or I can't believe you did that in my life, right? So I have to carry that around. And when we start that at an infant age, right, the mother, like, I can't believe, I almost feel like we eliminate the opportunity for hope, the opportunity for growth, the ability to change. And that's kind of the thing that I'm going to say gets kind of to me, where I go, man, how are we not supporting them up until the point that they can support themselves, right? So if you're coming alongside a mother and saying, hey, yes, your baby, which obviously is critical, like, let's take care of your child, but at some point, and probably very early on, somebody needs to be taking care of that mother and giving her a choice in her mind that says, maybe I'm not the compilation of everything somebody said about me. Absolutely. Maybe I'm not, this awful human being, right? I think we look at, I heard something the other day, and it was really, really revelational to me, is that when we drive down the road and we see somebody on the side of the street, we see a homeless bum, alcoholic, drug addict, whatever you want to say, right? But he said, that's somebody's son and that's somebody's daughter.
Absolutely.
And that's imperative for them to realize that as they have choices, You know, if you kick them to the curb, or you said AMA, which is against medical advice.
Against medical advice.
Yeah, so these people leave the hospital knowing full well that it's a doctor wouldn't have them do it. And they do that based on, I don't want to face the shame. I don't want to face the voice. I don't want to shape.
Yeah, absolutely.
I mean, it's all that stuff.
It's that, and it's the addiction, right? Because the addiction is stronger than anything else. And so when I first come in contact with a woman, and my very first thing, and this is true for anyone in our organization, the first thing we say is congratulations. Because often they have never heard that before, right? They've never heard it. And also just letting them know that the oxygen mask, right? So you have to take care of yourself first, you know, because often they will say, if they're on like a medical, a MAT program, medically assisted treatment, they'll say, oh, I want to stop my MAT program. I don't want to be on it because it's hurting the baby. So we have to really counsel them and educate them on the danger of stopping in the middle of a pregnancy, and also the safety of staying on that MAT program, which also ties into the education of healthcare providers that I do so much of.
Sure.
But also just understanding that the work that we're doing at the beginning of this pregnancy has such a greater and far-reaching effect than we realize, because what we're trying to do is tackle this generational addiction, generational poverty. If we can get that woman, who very well could be at the most motivated time of her entire life,
Right,
to start looking at things a little differently and understanding that they have support, they have hope, they have someone that's going to walk alongside of them. I go to hospitals when women are giving birth and in labor, and I'm standing there like a sentinel, you know, because I want to make sure that they're being treated fairly and with compassion, because often they're not. As soon as healthcare providers find out that they're using substances or they're on a mat, you can physically see the shift in their care that they're providing.
wow.
Not all. There's some fantastic nurses and doctors that we work with at the hospitals around the valley, but we've seen it, unfortunately. And even one time is too many.
Oh, absolutely.
Because having to face this type of discrimination over and over and over again is unacceptable.
Yeah. I mean, that's, wow, that's so much to unpack there. But the reality is that they need somebody, right? We talk a lot in our organization about connection, right? Somebody who is where you were, right? You're most qualified to help the person used to be, whatever that language is. It talks to the person saying, like, I'm here for you. And the fact that you're saying they may have never heard that before,
Ever.
I'm proud of you. You know, congratulations.
Yeah.
You know, welcome to the first day of the rest of your life. All of that type of stuff. Kind of, I can almost see the posture changing in a woman. Like, wait a minute, you came back, right? Because a lot of times I think that it's pretty easy for us to write the check. In fact, I go to a church where the pastor says the easiest thing to do is write a check. Are you willing to get on a plane and fly across the country or the world and help somebody? You know, that then we'll find your commitment level. You guys are getting on the boots on the ground floor type stuff and saying, hey, no, we're going to be here for you. And you mean it. Yeah. Right. And you show up again. I would think, as a mother that has probably been through some stuff. Like, let's be honest, if you're on the streets or in a situation that, you're using, you're tied up in addiction, whatever it is, I'm pretty sure that you are going to be one of the first people to say those type of words to her, but also to commit your time, resources, and energies to them. And that's probably empowering them beyond, just getting them through, right? Because just get through.
What it is, and it's not a Band-Aid. Right. Band-Aid. Right. And it's what the work that we do is not, it's not fast, right? Because we don't have any false expectations that she's going to automatically change her life and, stop using and, go back to school. And that is not the goal here. The goal is to empower that woman to make positive choices for her life. And and our organization does not have an agenda at all. So if that woman wants to parent directly, if that if she doesn't want to parent directly, if adoption is in the picture, whatever that looks like, I'm here for you. This is not about me. This is not my journey. This is not my choice. So we don't have anything around the support that we provide. This is all about, I'm going to walk beside you. And I also tell them, I'm never going to work harder than you do, ever. So being able to, and again, it ties into that empowerment, right? If she can see that the work that I'm doing today is going to have such a long-term impact on my unborn child, she might have other children, a spouse. I have, husbands and partners that come in and take classes with me and are involved. So now we see even another layer of positive effect, because now dad is getting involved. Then we can look into gender roles. Then we can, it goes on and on and on. It really is the pebble in the lake.
Wow.
When you see that ripple effect. So I think that, the nursery is part of what we do.
Sure.
Really, which is the big important one. Everybody wants to help babies,
Right.
But often we have a behavioral health outpatient site. So when sometimes the mood changes, sometimes the support isn't as great when they know we're helping women who are pregnant with substance use disorder. Then you start to see a shift, right? So that's another big thing that we really go out into the community, into providers, OB offices, hospitals, and educate and let them know, the safety of being on a MAP program, the benefit of being involved with Jacob's Hope as a partner. So when we develop a web of partnerships with other organizations, then I can say, hey, I haven't seen, Tammy. Have you seen her? I call her MAP program. Oh yeah, she was in here yesterday. And so now you start, or her housing or her sober lit, whatever. Now we start to see we've now grown that circle of supports.
Sure. That ties into a lot of what we're doing, right? That's
exactly. That's
right.
Why I'm here, Tracy.
Right. Yeah. I'm glad you said that, because I talk to a lot of people that are, I've got a couple of guys I work with right now that were born exposed, right? And so it's played a big part in their life forever. And I want to jump in. It's on the website, something I read about how the organization started. But for these guys, it's played a role in their life really forever. Like they were exposed and forever they're chasing this sort of feeling. And who knows where it comes from. It's so mind-blowing that a little bit of exposure at an infant's age can keep a person in that kind of feeling.
It is crazy, because if substances are used at any point during that pregnancy, even once at the beginning, all the way, once at the whatever, there's about a 50% chance that they could be born with withdrawal symptoms. Okay. Wow. So when we think about a baby being put in a NICU that's in withdrawal, it's kind of related to an adult, right? What do you do with an adult that's in withdrawal? So, right. So we're not going to put that adult in a bed alone with bright lights, with loud noises, and schedule when they're going to get picked, tended to, or whatever it looks like. That is what a NICU is designed for, because medically fragile infants, that's the care they need, right? Babies in withdrawal, they need to have connection. You can see an infant when they're not being held by a parent or a caregiver, and then they pick them up, and that's that skin-to-skin contact. You can immediately see that come down. So when we think about self-soothing in humans, right, when a baby is born in withdrawal and is not provided the opportunity to be able to be consoled when they're feeling that way, they don't develop those pathways in their brains. So, you drive through a cornfield and you make a track. And if you drive that cornfield a bunch of times, it's deep. So to try to go off that track is hard. Same with your brain. You create those pathways. And at the very first stages of life, if you're not creating the right pathways, it's very difficult to change that moving on. And those infants will have lasting effects. It may not be addiction. It may not be, anything that you would think, but it will affect some part of their lives. And also being able to educate these families on what to look out for so that they then can be advocates for their children in the future. with schools, with healthcare providers, with the pediatrician. If something's going on and like, maybe it could be this, let's look into that. But if they don't know, they don't know.
Right.
So again, we're affecting generations.
I think that's the key, right? Is that I think we all would come alongside and go and recognize that, like, hey, you've slipped down the path of addiction, right? Maybe I think the reasonable age would probably be maybe college, just a little after college, like, oh, you hung on to your college years a little bit too long. Like, we'll support that person. Like, you went down the wrong path, high schoolers, but we're talking about core level, like day one, this is a path or a avenue where this child has been kind of forced it down. If I'm using the right language, I don't want to overstep my bounds, but like they're not making a choice. Like you said, they've been exposed. Right. And now as a society, as a parent, as a friend, as a community leader, it's my job to make sure that we're meeting them where they at. We might have 6-year-olds that are like, I don't know what I'm feeling, but ... Exactly. And come to find out, mom did this during pregnancy. And if we're not there supporting it, things could go bad.
Well, and as a society, right? Because, and there's a couple of points here, though. As a society, are we going to choose to support the beginning, or are we choosing to support the adult for the rest of their lives, or the teenager for the rest of their lives? Because that's the choice that society makes and our communities make when they don't really get involved and invest in these early intervention programs. And that's truly, we're pretty much the earliest. We're in utero.
Sure.
So you can't get any earlier than that, but we're not only affecting that infant, right? We're affecting the mom, the dad, like we talked about. And also a lot of our clients, a lot of our women are not your typical, right? We always say this about addicts and addiction. It's not what you think. Everybody has this idea. So a lot of my clients have been on a steady MAP program for a year, 2 years. They're solid on their medications. They're doing everything they need to do. They have a steady job. They have a home. They have a car, everything that we all have.
Sure.
This just happens to be that. So they come to us for support on how to navigate and manage, and be able to talk to their family, their friends, their coworkers about what they're going through in a language that, advocates for themselves and also educates others too. So now we are having another effect on a broader community. It's just like the cost savings to a community. And I'm not going to talk a lot because it gets a little dicey. An average stay for an infant in a NICU is bottom line around $3,000 and up a day. Okay, to stay in a hospital. Access pays Jacob's Hope around $600 a day.
Wow.
So if you do the math on that, which I did, but I'm not going to go into it here, doing a cost-benefit analysis on this, the cost savings to the community and to the everyday taxpayer, it just those numbers alone should convince anyone. But again, large hospital systems, large healthcare systems, changing mindsets, changing the way you do things is difficult. It's a challenge.
How is the community getting involved other than financially, right? Which is pretty obvious. You need some money. Like, or you're running a business, an operation, Jacob's Hope is, trying to provide a service. What are some of the other ways that you see the community either already getting involved or where you guys need help and what comes from that?
Yeah, we do have our volunteer base is just incredible. We had a news story about 1.5 years ago, and we received 1,200 applications for baby cuddlers, right?
Wow.
We train volunteers. They go through a lengthy training process, background checks, so that they're able to come to the nursery and hold that baby. We can have a baby that doesn't get put down for 48 hours. Because that's what we have. Caregivers, we have mom, we have dad, we have our volunteers, we have our NICU nurses who work for us, we have our CNAs who work for us. So, and me, I'll sneak in there every once in a while and grab a little. It's a nice perk.
Yeah.
So that, but there is, everybody wants to hold a baby, but there's lots of other things. So we have organizations that'll come in and do a cleaning. They'll clean the offices and the nursery once a month. We have groups that'll come in and pack our backpacks, because our backpack program, I can't believe I didn't bring one, but it's very important. We usually give these to our new clients, our new moms, and it'll have hygiene. It has a baby blanket, a baby book, and a packet of information in it on Jacob's Hope, what we do, how to contact us. And the backpack has been amazing because it's often the first time this woman has connected to her pregnancy when she opens that up and sees that book or sees that blanket. And you can just see that because they don't want to connect with it, right?
Right.
Like you spoke about the shame, the guilt. But we've also had hospitals that'll call us up and say, hey, I just had a woman walk in. She's obviously unhoused. She's going to give birth, but she has her backpack.
Wow.
So
That's got to get to you. Well,
I mean,
oof.
it's incredible. We're working with Mesa PD and that are carrying their backpacks in the trunks of their cars, their patrol cars, because they're coming in contact with these individuals in the community. But we also have, one-offs. Like we're doing a Cocoa with Santa event. We did it last year and it was really successful, and we really want to blow it out this year. So, having volunteer groups come in for that to help set up, to donate tables, chairs, tents, whatever,
Sure.
that kind of thing. So packing backpacks is a big one. And also printing companies that have also volunteered to print off some of our flyers. All of these things are very expensive, obviously.
Sure.
And when you have not a lot of revenue coming in, because we take all insurances, all access, no insurance, and we don't get paid for a lot of the babies that we care for because we're never going to turn one away, ever.
Well, we're going to do everything we can on our socials and our followers to make sure that they know how to get in contact with you and start to do some work. But I think you hit on one other thing, the continual education portion of that. Like, we don't want to take these mothers, and I think a lot about the people that I work with in addiction, and I'm working with grown adults, right? And the idea of like going through a 30-day treatment, in your case, maybe, a 3-day treatment or, a shorter period of time, the pat on the butt and good luck like speech doesn't work. It takes a community coming around and then re-injecting them back into the community. I can imagine, and I'm just gonna say this, probably it's true, but we'll verify with you in a moment. But like moms that have been through your program probably get absolute joy coming back full circle and being part of somebody else's life.
Yeah.
What does that look like?
So we just actually had my first cohort come through my classes. So I provide classes on infant care, NAS specific care, which is neonatal abstinence syndrome. We do DCS readiness and preparedness. So we work with them throughout that pregnancy. So we just had our first cohort, and one of our women that went through our program just completed her peer support training and will be coming back to work with us. She's also training as a doula peer support. So, to have this kind of resource, and it's invaluable, but that's the full circle. That's what we want, is to have these women coming back and then giving back,
Right.
because that's how important this was to them and how it affected their entire lives and their children's lives.
I think that's important for the audience to hear too, is figure out who you are qualified to help. Right.
Yeah.
So we talk a lot about that. Like, I'm pretty passionate about what I do. I cannot sit in front of a group of mothers and say, hey, I that. No, I don't know what that's like.
Right.
I know what it's like to
Right.
be drunk dad or absent husband, but I don't know what it's like to be a mother that's gone through the absolute worst time of her life in some cases that should be beautiful. Right? Like, should be beautiful. Like, there's so many people that would say, what's the best day of your life? And you're going to have people say the day their kid was born. I guarantee in your case, that's not always the scenario that it plays out.
Yeah, exactly. And that's not. And what are your strengths? So there's a whole lot of resource and referrals that I do. That's probably half of my job, because no one person or organization can do it alone.
Sure.
So I'm constantly finding educational programs. Housing is a huge one, as we know, with the population. So being able to connect them, and also what happens after? What happens after baby's born? So I have 12 text messages right now from women who have given birth within the last 2 months or so, that are still reaching out, and I'm still reaching out. Hey, here's an email about a job fair that I just saw.
Sure.
Or, because you cannot stop. This type of work doesn't just end, it is a lifelong commitment. But again, I'm never going to work harder than you do.
Right. Oh yeah, they absolutely have to want it, right? Like that idea of, I like the language of eliminating excuses, right? Like, we're going to give you the books, we're going to give you the bus pass, like, get to the bus, you know, that sort of stuff. But I think that, excuse me, the community has to recognize that there is an absolute gap in what we think is care or continued care, right?
Yes.
Like getting that baby born and healthy and on, you know, for the rest of its life is like, not really, right?
Yeah.
There's a huge part of getting mom, dad, family, you know, everybody involved, educated and on board. Like, this is a scenario that's going to carry on beyond this couple week period.
Exactly. And that's what we're trying to do, right? Is to build that foundation so that then self-sustainability is possible. You know, without all of these supportive resources and this aftercare planning, what's the point?
Right.
You're just bringing a baby into the world and then see ya.
Yeah, good luck.
Yeah, which is never the case, and no one should have that, addiction or no addiction.
Right.
You know,
Absolutely.
we all need support and we all need community to be able to stand by us and walk with us and give us a helping hand when we need it.
Well, we're going to do our best to give you a helping hand. If you've watched today and something about Jacob's Hope has struck a chord with you, I'm going to ask you to click on the link below, follow, like, share, all the stuff you know already to do. But more importantly, find the community in your area, because I know we have watchers all around the world that are probably thinking today, who is that in my community? I'm going to implore you to find that place. Who needs to just have babies held, backpacks packed, and all of the work that's getting done at Jacob's Hope can be done in your community. I'll see you next time.
I hope you heard something today that gets you to take one small step into the version of the person that you want to be. For more content like this, subscribe to our channel below, or you can go on letsgorecovery.org. Until next time,